The next one of these mobilizations with movements that we're going to take a look at is an extension movement. So if I can have you turning this way that we can see that lateral view. What is happening during extension? During extension, we have the superior segment extending against the inferior segment. When this happens, the superior segment, the vertebral segment that has the issue with the extension, will be doing an inferior posterior glide. Well, that's hard to do, right? That's hard to grab the vertebral segment and pull it into an inferior posterior position. So instead of taking the superior segment, pulling it into an inferior posterior position, I can achieve the same thing by taking the inferior segment and mobilizing that in this anterior superior direction. So for this extension movement, I'm going to mobilize the inferior segment. So if C6 was problematic with extension, I will mobilize C7 in an anterior superior position. Now I'm also going to accompany this with movement. So again, I'm going to find the vertebral segment that is problematic. I'm going to move inferiorly one segment because that's the segment that I'm going to mobilize. Then I'm going to have Amanda extend her cervical spine as I mobilize that in an anterior superior direction as demonstrated by the direction of my fingers. Then she is going to return back to a neutral position when I maintain that pressure either as a sustained or an oscillating type of movement. I'm going to have you turn again so we can see that from the back or the posterior side. So again, finding the vertebral segment that is problematic with extension, moving to the vertebral segment below. That way I can send that one or glide it. Should probably say glide instead of sending it. I'm going to glide that in an anterior superior direction during this extension movement. And there's my mobilization with the range of motion. And now we're going to go back into the neutral position as I continue with that pressure of the mobilization. Cool.